All right, government cost-cutting efforts reverberating to companies nationwide. A new report showing U.S.-based employers cut nearly 86,000 jobs in August, up 39% from July. It's the highest August total since 2020, and before that, the Great Recession.
The good news, the Department of Government Efficiency is cited in the report as a leading reason for job cuts in 2025. On the private side, pharma and finance companies leading the corporate announcements.
And D.C. is not done yet either. The Veterans Affairs Department instituting a new cap on staffing levels and tightening future hiring for the agency that currently employs 461,000 people, with a plan to cut 30,000 by the end of this fiscal year.
Let's bring in Veteran Affairs Secretary Doug Collins. Mr. Collins, thanks for joining us.
I'm glad to be with you.
So DOGE got a lot of negative coverage from people in our industry, either that it was slashing the federal workforce and putting all of us at risk, or at other times arguing that it really didn't amount to much and all this streamlining was going to happen anyway. 30,000 people you're planning to cut this year from your department. Is that going to impact patient care? Is it going to be tough to serve people, or is it possible you get more efficient and better at customer service?
No, it's going to be great, Jay. It's good to talk to y'all tonight. Look, one of the things, let me just correct, sort of give some color to those numbers you just gave. We're about 460,000 people, maybe a little less. We're going to be about 450 by the end of September. But that represents 30,000 people who chose to take deferred or early retirement or left under early retirement plan. We've not fired anyone, contrary to what many people are saying and doing, especially on Capitol Hill and Democrats and others. We haven't. Those that come through attrition and through retirements. And that gets us at a workforce, remember, that has grown in the past 4 or 5 years with $100 billion in budget and 100,000 employees. So we're at a point now, and you asked the question, has it affected us? Well, yes, it's actually affected us in a good way. We've actually cut our backlog of disability claims from 260,000 to under 150,000 in the last 4.5 months. We've gotten better wait times and better quality service for our veterans coming into our VHA system. Our mental health appointment times are down, other appointment times are down. And also on the fact of that, we actually added 1 million extra hours of service to our VA healthcare system so that veterans can get their care after hours or on weekends. Look, what we've done is simply got a department that was basically unwieldy, that they had decided that had been thrown by the Biden administration with just money and people with no leadership. We're providing leadership to give the American people what they deserve, but more importantly, the veterans what they have earned.
Really good point. And I just want to underscore the size of the VA. Our agency is massive. I mean, it's among, not the largest, but it is certainly among the largest. I mean, one could see how when you just have such a large bureaucratic entity, there probably is some room for slimming down and some efficiencies. Kind of a specific question for you, but on the Business Network, we're always talking about artificial intelligence. And there's a really interesting meeting at the White House today on artificial intelligence. As you're also slimming down the workforce, I'm curious, are you able to kind of leverage artificial intelligence to make folks more efficient and maybe, help make sure that you're maintaining or continuing to meet the needs of your patients and those that you serve?
Definitely. We're doing that. We're increasing our health records management system. We're including more AI, robotics, things like that in our hospitals. I actually got to go to Houston, and I don't think you want me to do surgery on you, but I got to actually play with one of I call it one of our new robotic arms that it cuts down time in surgery and it speeds up the recovery time. From our benefits analysis, we're able now to use technology to help people. We don't take a person out of the system necessarily, but we're able to reduce the amount of time that we have by taking looks at records and scanning the records and saying, okay, this person already has this in their medical record, then they're going to qualify for their disability claim. That speeds up the process, and we're able to move through things in a lot quicker way. So we're using all of our technology and all of our human resource capital to make sure that we're doing one thing at the VA, and that's take care of veterans. And again, for all the hyperbole that has been out there, look, we have a workforce that is freed up to be leaders, to do their job, to set standards and keep standards. And I think that's what has been missing. When you looked up usually when you look under bureaucracy, you see a picture of the VA. We're the largest civilian organization in the federal government. We're still larger than the active duty Army, but we've got to get our handle on it. One of the things we're also doing right now is finally getting a manning document, so we actually know where all these employees, speaking from a business channel perspective, can you imagine a company as large as ours or association as large as ours who did not have a good idea of where their employees were located? There you go. That's what we have.
Yeah, that does seem like a problem. And if you
Minor
don't know
problem.
where they are, maybe they too can be let go. Just throwing it out there. Would love to hear what the taxpayer savings are from all this. Perhaps next time we have you on, Mr. Secretary, unless you want to give us a number. Taxpayer savings this year.
Yeah, we're saving through contracts and conductions. We've cut hundreds of millions of dollars out of things that we shouldn't be a part of, and we got more coming. But again, it's not about the savings; it's about the quality. VA has been measured on the wrong metrics for years. We're measured on budgets and people size instead of quality of care to our veterans and quality of service to our veterans. That's the metric I'm using now.
Okay, thank you, Mr. Secretary.